Hello, everyone. Thank you for joining in. We're seeing everyone joining. We have this. Um, let's let's wait a bit for a few colleagues, participants to join in. And thanks so much for those who came in early. We apologize because we had a mistake and was not able to set up the waiting room. But let's wait a bit, and we will start in about a minute. Thank you. Good afternoon, good morning, and good evening to everyone. We welcome you all, especially those of you who are joining from far away or at late or very early times. Thank you so much for your interest to join this exciting WHO EPI-WIN webinar, Stronger Together, Innovative RCCE Capacity Strengthening Tools. So we are seeing more and more people, colleagues joining in from different countries. And many of you have joined EPI-WIN have been with us for a few years now. For those of you who are new, EPI-WIN is WHO Information Network for Epidemics for Science and Knowledge Translation in Health Emergencies. And our goal is really to translate science in ways that are accessible, understandable, and relevant for evidence-informed actions and decisions, especially in health emergency preparedness and response. So today we have a great panel of experts, which I will introduce shortly to discuss innovative RCCE capacity strengthening tools. My name is Lester, and I will be hosting today's webinar. So you can find here the list of speakers that we will hear from. We will be starting with an overview. Our colleague Supriya Besbarua will be speaking on behalf of Kai von Harbu, our unit head in community protection and resilience. And this is an overview on the importance of innovative RCC tools. Then we will hear from Thomas Moran, RCC Technical Officer from Community Protection and Resilience from WHO Geneva. He will give us an overview of the global RCCE competency framework. This was published last year in May 2024. And then we will listen to a short video from WHO Europe by Christiana Salvi, who is the Regional Advisor for Community Resilience and Protection. She will give us the story and the concept behind two tools, and you will hear more about these tools, the CAP map and the Plan Creator. Next, we will also hear from another speaker from WHO Europe, Nancy Claxton, also with RCCE, capacity building for RCCE-IM. And she will give us some innovations and presentations on the tools and how these tools were developed. So that's the next part, and that's from Europe. And then we will hear an example from Belgium, a specific country. So we have here Manon Upa from the Belgian Federal Public Service in health, food chain safety, and environment. She will give us the experience of Belgium in uniting stakeholders to create a national RCCE-IM plan. So we will have several examples and discussions from Europe, and then we will proceed to the experience in Latin America, in PAHO. So we have Tania Escamilla, who is a specialist, and she will give us an experience and some tools on RCCE in response to dengue dengue outbreaks, and also the PAHO virtual campus course. So these will be our sets of speakers, and then we will have a short Q&A and another tool that we will be using also to continue interaction. So as many of you know, this webinar is being live streamed also on the EPI-WIN YouTube channel. And we will have recording, and we will also share the recording once available in our website. We will be sharing with you the address. Many colleagues have already posted their names, their location, and organization in the group chat. So for those who just came in, feel free to do so. We'll be happy to hear where you're coming from. We will also have interpreters for English to Spanish and Russian. So you can find the interpretation tab in the bottom part of your screen. Just click it as needed. If you have any questions, please direct them. Use the Q&A box and not the chat box. We are monitoring the questions, and we have colleagues also with us who will help in answering your questions while the discussions are happening. So we appreciate that they could join us as well. So again, feel free to post your questions in the Q&A box. Keep all your comments relevant to the topic and also positive. Please avoid negative, rude, or disruptive comments. We will remove you from the webinar if this happens. And as you're all familiar, we we want you to be fully engaged in the webinar. So during the topics, the short talks, we will be launching polls, and you will find them in your Zoom. So we'll be happy if you can also participate in these polls. All right, so without further ado, I will hand over to our colleague Supriya, who will give us an overview on behalf of Kaivan Harbu on the importance of innovative RCC tools. Supriya, over to you.
Thank you very much, Lester, and good morning, good afternoon, good evening to everyone joining to get us today for this topic on innovative risk communication and community engagement capacity strengthening tools. I would like to welcome you and these other remarks on behalf of Dr. Kai von Harbu, who apologizes profusely that he could not be here today. He tried till the last minute, but unfortunately he was caught up in another meeting. He's actually at the World Health Summit in Berlin. So he's asked me to say these words on his behalf. What he says is, well, why RCCE matters in community protection. In health emergencies, the more traditional technical responses such as surveillance, clinical care, logistics, etc., are crucial. But without trust, two-way dialogue, and informed communities, those interventions cannot reach their full effectiveness. That is why community protection was included as one of 5 intersecting subsystems in the WHO Health Emergency Preparedness, Response and Resilience Framework, which is the HEPA framework. Community protection refers to community-centered actions that deliver impact to protect those who are at risk or affected by the health and social impacts of emergencies. Now, risk communication and community engagement enables this. The first of the 3 objectives under the HEPA community protection calls for risk communication and to be strengthened. RCCE is not about broadcasting messages, as there is still some perception. It is enabling behavioral shifts, local adaptation, and community ownership. HEPA's emphasis on systems, resilience, and readiness means that building regular RCCE capacity is aligned with the broader goals of health security. RCC is also core to international health regulations, IHR, which is a legally binding instrument for WHO member states. Under IHR, countries have obligations to detect, assess, notify, and respond to public health risks. RCC is integral in detection through community alerts, in assessment through community feedback, qualitative intelligence, and in response by communicating risk, supporting health actions. It's therefore an IHR core capacity, which requires countries to build and maintain in order to detect, respond to, and manage public health threats. That's why RCCE capacity building tools are important. Without adequate and sustained capacity, RCC in countries tends to be reactive, ad hoc, under-resourced, and donor-driven. Great strides have been made in this area, but even now, many countries and subnational health systems do not have systematic routine capacity for RCCE. There's limited staffing with the needed technical skills, gaps in coordination mechanisms, monitoring and evaluation tools sometimes are not quite what we would like them to be. Capacity building tools, such as you will hear about today, help move RCCE from being only during crisis and emergencies to institutionalized, anticipatory, and resilient. Furthermore, capacities built and documented through tools are more likely to persist and have institutional memory, even across leadership changes and successive emergencies. These tools allow countries and subnational levels to map their current RCCE and infodemic management capacities, spot strengths and weaknesses, and tailor interventions accordingly. They also bring together government, civil society, media, and community actors to jointly plan RCCE strategies. RCC also intersects with sectors outside health, such as education, water and sanitation, security, media. Capacity tools that you will hear about today foster coordination across sectors, aligning messages, using shared platforms, speaking with one voice to prevent conflicting advice. They facilitate integration into broader resilience, governance, and disaster risk reductions frameworks. These tools help in standardization, and more importantly, in our current resource constrained times, they can help with more streamlined and efficient resource allocations by identifying priority gaps and spotting weaknesses. What has WHO done in this area? As you see, will be talking about that. WHO's work in this area over time. We've developed practical tools to strengthen RCC as a core part of community protections. These include the RCC competency framework, which was developed by WHO headquarters, the capacity mapping and plan creator tools by WHO Europe, practically RCCE toolkits, and the adaptation of these toolkits by regions into online courses, which is you will also hear about. In addition, the Open WHO has many RCCE courses for use by national and subnational staff. And through EPI-WIN, we attempt to make these tools accessible and share with you how they are used so that even more people can use them at the national and subnational level. Thank you once again for joining us today, and we hope that you will find the session useful and, more importantly, use these tools to strengthen RCCE and IM in your countries. Thank you very much. Over to you.
Thank you so much, Supriya. And we apologize because the sound is a bit disturbing. But thanks a lot, Supriya, for giving us an overview on the importance of the RCCE tools, what has been happening. So in the next few minutes, many minutes, we will be listening more to these tools and how these are applied. Let me turn over to our colleague, Thomas Moran, who will be giving us an overview of the Global RCCE Competency Framework that was published last year. Tom, over to you. Thank you.
Yeah, thanks, Lester, and I hope everybody can hear me clearly.
Yes,
Great.
Tom. Thank you.
So good afternoon, everyone, and thanks for the opportunity to make this brief presentation on WHO's Risk Communication and Community Engagement Competency Framework. It's the first of its kind for WHO in this technical area, and for us in the Community Protection and Resilience Unit, a foundational document. While it was developed and published last year and is already in use in some regions and countries around the world, this is the first opportunity we have had to present it to such a wide and engaged set of practitioners and stakeholders. So thank you for those joining today, for your continued interest in WHO's work, My name is Tom Moran, and I am with the Community Protection Resilience Unit here in WHO Geneva. It's a pleasure to be here today. So before getting into the nuts and bolts of the framework itself, I thought it would be useful to provide a little context of why the framework is both timely and important. First, it's clear that the world is having to deal with an increase in health emergency threats and complex crises. And this is driven by many factors: climate change, related events, population movements and conflict, for example. And this is evidenced by the screenshot on the right of the slide here, which shows that WHO is currently responding to more than 30 graded emergencies. Secondly, and significantly for us, in this evolving landscape of public health, there is an increasing recognition of the importance of community-centered action as critical for more equitable and effective programs. And this action is primarily driven through the consistent, local, evidence-based risk communication and community engagement practice we know is so important. And this has been proven over and over again in recent public health emergencies, whether it be during the recent COVID-19 pandemic, during recent Mpox public health emergencies of international concern, or more locally, during recent Ebola and cholera outbreaks, which still affects many countries today. Next slide, please. So why does this context support the need for a framework such as this? Well, despite recognition and recommendations, and even though RCC is a core capacity defined under the IHR, the International Health Regulations, and has been defined for more than 20 years, there are consistently reported capacity gaps in many countries and regions around the world. And you can see this is represented in the data within the graphic at the bottom of the slide, which is the latest state party self-reported data on IHR capacities captured from 2024. There has also been different definitions and interpretations of what RCC is and what it entails, different understandings of what RCC delivers across regions and sectors. And this historically has often led to fragmented approaches, reactive rather than proactive action, uneven investment, and even sometimes duplication or wasted resources. The need for agreed standards has been evidenced for some time, and a common framework promotes the consistency and shared understanding that has been missing in the past. Next slide. So what does this framework do? Well, it's a big step forward. It provides a standardized evidence-based foundation to strengthen RCC capacities across the world. It clearly defines the core knowledge, skills, and behaviors needed to communicate risks clearly, manage misinformation and counter disinformation, something that really resonates with many member states and partners today. And it also enables us to engage and empower communities more effectively. Importantly, it also creates a shared global standard, one that helps us build and sustain the RCC workforce, improve coordination across regions, and strengthen accountability and performance in line with best practice and ethical considerations. By integrating RCC into national systems, the framework ensures that member states, supported by WHO and its partners, are better equipped to engage communities, build trust, and communicate risks effectively during any public health emergency. Next slide. So how can we apply it in our day-to-day work? There's a number of ways it can be used, a number of practical ways. It can guide workforce development, for example, serving as a standardized reference for building team competencies. It supports needs assessments, helping identify gaps and areas for improvement. For professional development, it provides a foundation for creating structured learning pathways and training plans. It can also inform recruitment, offering a clear reference for job descriptions and terms of reference, for example. In performance assessment, it helps develop meaningful indicators to measure RCC effectiveness more clearly. And finally, it supports program development, ensuring RCC learning and training activities are consistent and aligned with global standards. Next slide. So who is this framework for? The framework is designed to support really everyone and anyone involved in risk communication and community engagement across different levels and sectors. First, it's for RCCE teams, those who design, implement, and execute RCC strategies and plans during both preparedness and response phases. It also supports academic institutions and capacity building experts, providing a foundation for training, research, and curriculum development. Emergency response teams can use it to strengthen coordination and ensure RCCE is systematically integrated into response operations, something we know is incredibly important at the field level when we're responding to a disease threat. We've also considered policymakers and administrators who make decisions on staffing, structures, and investment into RCCE systems, and importantly, community-based organizations and health development partners who play a role in putting these competencies into action at the local level. Finally, it contributes to building the skills and confidence of the broader public health workforce, ensuring RCCE principles are embedded across the system. Next slide, please. So before going into the structure and the contents of the framework itself, I thought it would be useful for people to see some of the steps and actions involved in its development. The work took place over a period of more than 12 months and included dozens of people and collaborators who, during, for example, the foundational work, undertook a desk review, established a working group to guide decision-making, developed RCC personas to better identify and understand end users of the document, as well as conducting consultations and focus group discussions with different stakeholders. Following this work, formulation of initial competencies began, feedback processes were continued and refined, as well as alignment with foundational models. Finally, in the last stages of design, the competencies and framework were reviewed for quality and consistency using SOPs and WHO's guidance for the development of competency frameworks. So really, really quite a complete and thorough process for its development, review, and publication. Next slide, please. So as you can see on the right, the structure and content of the framework is organized into 5 behavioral competency domains and 3 technical areas of practice activities. The domains were drawn from WHO guidance and adapted by the advisory group based on feedback and suggestions. Within the domains are 13 defined behavioral competencies that together represent the behaviors that RCC practitioners are expected to exhibit in their professional roles. The structure of separating behaviors and activities is also in alignment with WHO guidance for developing competency frameworks. The foundational model on the left of this slide is an illustration of this and a well-established model used at WHO. The inclusion of behaviors is important, as they are the soft skills which are often overlooked by learning and training programs, but they are essential components of effective action between emergency response systems and communities. Together, the behaviors and the activities become instrumental for building resilience, trusted relationships with communities, and fostering collaboration, ultimate goals of our work. Next slide, please. Looking one level deeper, we can start to see how the framework starts to enable us to define practice area activities, categories within, and some of the individual tasks that are critical for these practice areas. While the tasks here are not representative of the full set in the framework, a selection have been taken and mapped here across the health emergency cycle to demonstrate how this document can be used, very flexibly across all the stages of planning, implementation, and evaluation. While we won't have time to go deeper into the structure of the framework today, I encourage all of you on the call who lead or support the planning, implementation, or evaluation of RCC or community-centered programs to take the time to explore the document. And we've got the links to the document on the next slide. Next slide, please. In summary, looking ahead, the framework is designed to be flexible and adaptable, allowing each country or organization to tailor it to their specific needs and capacities, to define some of the attitudes and skills also that are critically important for a framework such as this. It will continue to evolve over time, informed by feedback from implementation, updates to IHR benchmarks, when there is new evidence from RCC research, and advances in technology and learning. Ultimately, this is a living framework, one that will grow and improve as we learn, ensuring that RCC remains a strong, trusted pillar of public health preparedness and response worldwide. Thank you for the opportunity today, and we look forward to working with you as we continue promoting this important agenda, which places community-centered action and capacity at the heart of equitable and effective emergency programs. Thanks so much, and back to you, Lester.
Thank you so much, Tom, and thanks for going us through the document, the RCCE competency framework, why it is important as a global standard, and also how it was developed and how countries can actually apply this. You might see Paul in your Zoom as well, so feel free to participate in that. We will be listening a short video from Cristiano Salvi from WHO Europe, who will talk to us about the story and the concept of two other tools, the CAP map and the plan creator. So let me share this slide and let me know if you can. Hopefully, everyone can listen, can hear the sound.
And good afternoon, everyone. I wish I could be there with you in person, but I'm truly glad to join you by video today for what I see as an exciting moment. Capacity in risk communication, community engagement, and infodemic management, or RCCE-IM. Today, we are introducing two important tools, the Capability Mapping Tool, or CAP Map, and the Pocket Plan Creator. At the heart of these tools lies a simple truth. Health security is not only about systems and protocols, it's about people. And RCCE-IM isn't a technical extra, it's the bridge between institutions and communities, between policy and trust. Without it, even the strongest systems can falter. That's why these tools matter so much. They offer a fresh, innovative way to help countries build their skills and systems to engage communities as real partners in emergency management and strengthen resilience for the future. Reaching this point took time and determination. In 2017, we began the 5-step capacity building package, guiding countries through mapping, training, testing, and adopting plans. By 2019, over 20 countries in the region were already using it. Then the pandemic came. It changed everything, but it also taught us a lot. We learned that risk communication alone is not enough. It must go hand in hand with community engagement and infodemic management, 3 disciplines that reinforce each other. And we learned that response must also happen virtually when travel is restricted. With the support from the European Commission and the Pandemic Influenza Preparedness Framework, we drew on our experience from the 5-step package and the pandemic to create dynamic online platforms. We continuously tested and improved these tools with insight from over 100 experts. It wasn't always easy. We faced a cyber attack followed by budget cuts, but each challenge made the tools stronger, pivoting to secure, efficient, in-house digital solutions. In just 5 months, we launched CAP Map and Pocket Plan Creator on 9 September this year. Already Belgium and Germany are using them, and we are preparing translations in all European regions' official languages. Just last week, I had the privilege of opening Belgium's kickoff meeting for their first nationwide RCCE-IM plan using WHO tools, an exciting 2-year journey ahead. The two tools complement each other. CAP Map allows in-depth assessment of existing RCCE-IM structures, systems, and skills. It's built on the global RCCE competency framework, expanded into capability framework tailored to the European region, a micro-level approach that reflects the diverse realities that practitioners face during health emergencies in the region. CAP Map covers 6 subject areas, 20 domains, and 77 subdomains, bringing together RCCE-IM and other capabilities that are mission critical for success, while emphasizing the vital role of infodemic management and evidence generation. The Pocket Plan Creator translates the CAP Map insights into action. It features 10 interactive modules for developing all hazard or hazard-specific plans, complete with checklists, plan templates, and resources. To conclude, this is truly a moment of pride. These tools reflect teamwork, resilience, and innovation in the face of challenge. I want to thank Nancy Claxton for carrying out this process and the entire Community Resilience and Protection Unit for their creativity and commitment. And finally, let me just say we are one community of practitioners. These tools belong to all of us, and I hope you'll feel free to reach out and use them for your needs. Together, we are building stronger systems, deeper trust, and more resilient communities. Thank you.
Thank you so much. So that ends the video from WHO Europe, and also giving us an introduction on the CAP map and the plan creator. I think next part will be Nancy is here and will give us more information on these tools. So I'm turning over to you, Nancy. Thank you.
Excellent. Thank you so much. That was my supervisor, and she has been leading the way for us to do so many amazing things. So let me just share with you some of the work that we've been doing. Let's see. Okay. All right. So I'm sharing from a web version because I'm going to be jumping back and forth between a few items just to show you some things. But this is just an overview of some of the tools that we've developed to both assess and to develop a plan on RCCIM. So Tom beautifully talked about competencies. So he talked about the RCCE competencies that were developed at the global level, which are used by, I know a lot of you. I see a lot of friends in the audience who have mentioned the RCCE competencies, which go a long way, and they're really powerful in terms of building capacity at the individual level. The Euro team actually focused on the capability level, which is more of a team level, and we added infodemic management in there. So infodemic management is about misinformation, malinformation, disinformation, social listening. So it's understanding what the risk perceptions Euro region, but they're available to anybody. So capabilities basically are a blend of like personal and technical skills. Extra piece, and then that is what our tools are based on. Okay, so let me dig into those. So the first thing I'm going to show you basically are CAP maps. Oops. Can you hear me now?
Yes.
Just got a message.
Yeah,
okay.
But
all right.
I think the slide is not the window format. If that was your intention, it's okay.
Okay. Can you see this? Let's take a look at the tools slide now.
Yes, Nancy, it's just not on presentation mode. That's it.
Yeah, and I intend to do that because I'm going to go across and forth across all these tabs.
Yeah,
so thank you for your patience. Okay, so let's take a look at it. So the very first tool is the capability mapping tool. So let's dig into it. What it does is it essentially explains what a capability matrix is and what the framework does. So it goes into the nuts and bolts of what it means, what the domains are, the linkages. So if you want the theoretical background, here it is. You can download pieces. It is in English right now, but thanks to the Belgian and the German governments, we're translating it right now into German, Dutch, and French. And there are more languages that are available depending on you, of course. And then you can access the actual tool. So you just click on there and you're taken to a GIS site. So if you have low bandwidth, that's okay. It just takes a little bit of time. As you can see, I don't have great bandwidth. And so here we are. And there's two types of questionnaires. There's a core questionnaire, which is just 20 questions. So typically when I'm doing a training, I usually use the 20-question questionnaire because it takes a little bit less time, about 30 minutes, and it covers just the higher level domains. Whereas the full questionnaire asks 77 questions and it's much more detailed, but you can get a lot more information in that in terms of understanding what people's specific skills, knowledge, and behaviors are within that RCCIM capability framework. So if you are trying to figure out, okay, so what does my team actually know about social listening? What does my team know about crisis management? What does my team know about engaging community? This tool will help you figure out where people are. So it's your baseline. So understand where to start, how to start engaging, figuring out what the gaps are, what the strengths are, and then how your team can come together. Okay, so you fill this out, okay? Yes, I'm filling out this tool. And so then what happens, Nancy? So what happens is you get this result emailed to you. So it's a cluster chart. And so what it tells you, this thing in the pink, is basically telling you what your current capability is around these specific areas. And then the bluer color basically tells you what your target is. So you identify what your target is. When we work with member states or organizations, we ask the people who are in the leadership to say, what do you want your team to, what's the capability you want the team to have? So they say, well, we want everyone to be very strong in social listening, or we want people to maybe have a little bit of information about this. And so they help us define that blue line. And then the pink is individual. As a trainer, I take this to be able to define what a targeted and tailored training program is. As a person working in ministry, or if you're working with the Red Cross or the Red Crescent, you can look at this and see where your gaps are and to figure out how to fill those gaps. Okay. We do get a copy of those. We don't do anything with them unless you ask us to do something with them, but we just have it on file in case you lose it or what have you. Now you say, okay, we've got this. We know where everybody is in terms of capability. We know, this team needs to work on this area. This team needs to work on this area. Now what do we do? Then you come to a thing called a plan creator. So a plan creator is just that. It's got this beautiful little interface, and it basically gives you the theory or the framework or the flow of how to develop an RCCIM plan. You'll see the modules are here, and Manon, who you'll hear about in a minute, will talk about how they've been progressing through that in Belgium. And these are all the different steps to basically going through the different steps of RCCIM planning. Now, what do you do with that? What you do with that is you basically will access inside the guides and deep dives. There is first of all, the full plan creator. If you want to download it, you've got poor internet, you want to download it. But then there's also a template. So the template is basically just a Word document that you fill in the information specific to your country or your organization or your community group. Whoever you are, you fill in the pink spots with your information. Okay. So this is for all hazards. We're also working on one for pandemics. And so we're wanting to develop different types of templates so that people can use them and make them however they want. Now, in the case of some countries, what they've been doing is they've been putting it on Dropbox or on Box so that different teams can come together and basically work on it together, SharePoint. So we do not store it here at WHO. This is a document that you would own. If you want to invite us, we're always happy to join you, but this would be definitely from sitting on your servers, sitting on your platforms. Okay, so from there, you're coming up together with a plan. Then we're always here. So what happens is that the member states will come to us and say, can you look at our plan, or can you sit in this meeting with us, or can you advise on what we should do about this piece? Sure, that's why we're here. So we provide any kind of support that you want as you go through the process or after you're done with the process. At any step, we are here to support you. Okay, and so what do we want to do next? What we're trying to do is we're trying to make sure that you have access to these materials and that you can store them on your own sites. So as I said, we're working with Belgium, we're working with Germany, and they are translating. So they're crowdsourcing the translations and then sharing them with us. And then we would share with them a version of, like here, the French version and the Dutch version and the German version is coming. And while it has the WHO logo on it, we give them the files so they can put it onto their website. So it sits on their server. So if they can change it however they want, we give them the source files so that you have ownership of the content. WHO is there to support. The WHO is there to give any kind of resources in terms of technical support, etc. But we want you to be in control of your data and in control of your planning, knowing that we are one of your stakeholders. Okay. All right. So what does this mean? This essentially means that our team at WHO Euro have been working really hard to ensure that we have a set of tools that we can provide to you that will make your RCCIM planning possible. So many people think RCCIM is a nice to have, and really what IHR tells us is that it's a need to have. And so we want to make that possible for you to do that. Okay. All right, that's it from me. Thank you.
Thank you so much, Nancy. And it's really quite a lot, but really interesting and useful tools that countries can use. So thanks for allowing us to go through these. We promised that it will be an engaging webinar. And I think we can have a few questions, Nancy, if that's okay with you for
Sure.
now. Um, I think a question has come up in your screen. We could probably give you a minute to go through. So the first question is really on how you in your country would measure the capacities for working with the community and also risk communication activities. The second question is also about community competency frameworks. If you have used one before, or maybe you have used the WHO one. There's a third question on what tools do you use or plan to use now that you have heard a few tools. We will be listening also next to how the different countries are using these. All right. I think we can post the questions again a bit later after um, the experiences from Belgium and from PAHO. So maybe we can proceed already to the next presentation. What do you think, Nancy? Can I proceed?
That's perfect. Yes, please.
So thank you very much. So we already heard an overview of the tools, why they are important, the competency frameworks, and how countries can use them. Now we're getting to the more practical part, and we have an experience from Belgium here. So I turn over to Manon Upa to give us an overview on how a plan was done also in Belgium. Over to you, Manon.
Thank you, Lester. Good afternoon, everyone. As Lester mentioned, I'm Manon Upin, Crisis Communication Manager at the FPS Public Health in Belgium. Today, I would like to talk about the development of the Belgium Interfederal Crisis Communication Plan for Health Emergency, which integrates RCCE capacities. Let's go back 5 years ago when COVID-19 was making headlines. This pandemic disrupted every aspect of our society and mobilized the entire state apparatus, which faced major organizational challenges. We had to adapt quickly, inform our professional partners, target audiences, and citizens about the measures to be taken. The communication services of each FPS and public administration worked under pressure and all encountered the same difficulties: effectively reaching target audiences, gaining citizen support, and countering misinformation. Next slide, please. Starting in 2021, the turbulent period was analyzed by a special parliamentary commission tasked with reviewing the crisis management. The hearings reveal a clear necessity. Belgium must better prepare to face this type of crisis. Among the recommendations, several directly concern communication. Integrate a communication component into a global pandemic plan, develop methods that encourage public support and involvement, actively combat misinformation, and above all, integrate crisis communication experts into each FPS crisis unit. Next slide. In response to these recommendations, the FPS Public Health created a new crisis directorate called Directorate General Preparedness and Response to Health Emergencies, and developed a new generic preparedness plan in consultation with federal and federated entities. This plan includes a public communication module, which defines the responsibilities of communication units in the event of a health crisis, namely developing an operational crisis communication plan, identifying and maintaining communication networks, and clarifying roles and responsibilities through cooperation agreements. Next slide, please. In December 2023, we participated in the WHO RCCE Forum, where we discovered RCCE tools, including the plan creator and the capacity mapping. Following this forum, we organized a 2-day workshop with WHO and our partners to revise our current crisis communication plan. This moment was decisive. Gaps were identified, and we decided to jointly build an operational interfederal RCCE plan for health crises. All participants acknowledge that crisis communication is a collective responsibility. Working together on a common plan based on RCCE principles became an obvious choice. Next slide, please. After the workshop, we held bilateral meetings with each partner to understand their needs, their obstacles, and their methodologies. Then, we presented the project to the College of the FPS presidents, who approved it. So each organization designated 2 people to actively contribute to the project. Next slide. The bilateral meeting revealed several positive elements. First, engagement and positive dynamics. Partners motivated and engaged from the very beginning of the process. It's a co-creation of a national RCCE plan, not just an FPS-specific plan. Double benefits. It's an opportunity to integrate RCCE capacities into their strategy. And the project supports the capacity building and strengthens their resilience to crisis. Collaboration and effectiveness. With the challenging budgetary context, it's the importance of pooling tools, channels, and human resources. It's also deploying the right skills in the right place. And essential community-based approach, there is a need expressed for stronger community engagement to better reach priority audiences. Next slide. Challenge and opportunities. Challenge, we have a tight timeline. Our human resources are extremely limited. There is currently no dedicated budget, and it's a significant investment in time and effort. But we also have great opportunities. We have the support of WHO Europe. Our plan will be evaluated by international RCCE experts, and above all, we will strengthen our RCCE expertise and increase our resilience to crisis. The plan development. The plan will follow WHO's Pocket Plan Creator, divided into 10 modules, each developed over 2 months. The methodology is simple. T0, it's a scoping session where we will discuss about the methodology and how we will do for the module. T0 plus 4 weeks, there is a hybrid workshop with all the information of the different organizations. T0 plus 6 weeks, we send the consolidated version and remind for the start of the next module. And T0 plus 8 weeks, we have the partner approval and we send to the WHO for submission. Next slide. The tools to facilitate collaboration. We have set up an online collaborative platform that includes the link to WHO Pocket Plan Creator, the shared agenda. For each module, we have WHO theoretical documents, WHO case studies, and our Belgian methodology. Next slide. In conclusion, this project is a real challenge. We are moving forward with a timeline, limited resources, and no dedicated budget. But we deeply believe in the importance of collaboration, in co-constructions between public services, and in integrating communities at the heart of crisis communication plan. With the support of WHO, a proven methodology, and committed partners, we have all the tools we need to build an interfederal, operational, and effective crisis communication plan that fully integrates RCCAM capacities. Thanks for your attention.
Thank you so much, Manon, and thanks for giving us the overview of how it was developed, the processes, the stakeholders involved, and why it is really important. So thanks so much. And so we move from Belgium to an experience also from PAHO, from the Americas, focused on specific pathogen, which is the dengue. So Tanya, I give over to you. Oh, before that, sorry. Before that, let us launch the poll again. So while Tanya is preparing, we have the fourth question on the Zoom poll. I think it's more related to Belgium's experience. So can we launch the next question for the poll? Is it possible to let it come up? Can we have the poll question? Otherwise, we can probably just proceed with the next presentation. Wait, it is launched already, so I think our participants can view it. So thank you so much, because for panelists we cannot. Sorry for that. Thank you so much. Let's proceed to Tanya on the experience from PAHO. Tanya, over to you.
Thank you, Lester. I just want to make sure everyone's seeing the presentation before I start.
Yes, we can see it and we can hear you.
Thank you. Good morning, everyone. Good afternoon. I am Tanya Escamilla. I am the communication specialist for the Health Emergencies Department at the Pan American Health Organization in Washington. And today I wanted to show you a very interesting tool that we have since June 2024. And it is a very practical and short course on how to launch an RCC initiative when you are facing a dengue outbreak. So we developed this course, started in 2024. Two PAHO departments work together in order to have this tool ready for everyone who might need it. The Communicable Disease and the Health Emergencies Department came together in order to produce this tool that is really targeted not only at people that work on risk communications and community engagement, but also colleagues that work in health promotion, colleagues that work in institutional communications in the local health authorities. We really aim to have information specifically for the subnational level, so not only the Ministry of Health, but the local health authority. And we base the content on WHO's Risk Communication and Community Engagement Readiness and Response Toolkit for dengue fever. We took that guidance and we transformed it into a story that you can follow throughout 3 or 3.5 hours, depending how you manage your self-instruction on PAHO's virtual campus. Open to anyone and everyone, completely free. We have a website, and then you have the link and you have the QR code where you can access this course, which is available in Spanish and English languages. And we are following two characters in this course. We are following Brisa and we are following Benjamin. Brisa is a health promoter, so Brisa has a more of a profiling health promotion, which is one of our key roles here in the Americas. When we go to countries and we go to the subnational level, health promoters are the people that are in the field and that really know communities, engage with communities on a day-to-day basis, and really know what is best for their communities. And then we have Benjamin, who is a health communications expert, and they work in this town of Aldrelias in the local health office. And they are facing an unprecedented rise in the number of patients admitted to emergencies at the local health center. We try to reminisce from the situation that we lived in the Americas in 2024, when we experienced an unprecedented rise as well in dengue cases. There were more than 13 million cases reported in 2024. That's 3 times more than in 2023. We had more than 8,000 people, who died from dengue, from severe dengue. So we really try to make this as a scenario that we could be facing again, as dengue is endemic in our region, and it's also a seasonal disease that we have in the rainy seasons in both hemispheres in the Americas. And you're going to follow Brisa and Benjamin through 5 stops and a final quiz. And the first 2 stops we give the the explanation of the content that you're going to look at. You have the introduction to the disease, and then stop 3. We really work together with our technical and scientific colleagues from the Communicable Diseases Department to have every technical aspect related to get to know better the dengue virus, the symptoms, so we can then move to the RCCE toolkit, which we, of course, as I said before, we based it on the WHO's toolkit, but we also adapted it to what makes sense for us in the Americas. And stop 4 comprises, the depth of what you can do when you face this type of dengue outbreak. And we have 9 tools that you go and move on, and you work with Brisa and Benjamin's team. You can see the team right there. They have debates, they have discussions while they are moving forward in developing all of these tools that serve to respond to the dengue outbreak. And these are the same tools that we have in the toolkit. As I said, we try to adapt it more to the reality in our region. And lastly, some learnings after working on this course. We now know that shorter and more practical courses lead to more engagement. We have more than 10,000 enrollments since June. And when we compare to another theoretical RCC course that we have on the virtual campus, really the difference is the gap is abysmal. So we have now the challenge of producing more practical and shorter courses because people really don't have the time to do the RCC theoretical course that we have is 6 to 7 hours. And even though it's also a self-instruction that you can handle at your own pace, this course has had triple the engagement and the enrollment than the other theoretical course. So now we're looking at how to really apply practical knowledge in this virtual learning landscape, apply to different teams. We are working on producing an influenza RCC practical course, community protection course for the Americas in the next year, because we know that it is through practical examples and also telling a story that we're going to achieve more engagement. And of course, I have to mention, this has a cost, and this is also a teamwork. Many people put in their hours of work in order to get this content running. People from the team at the virtual campus, at the PAHO virtual campus, they are a wonderful team that supported all this process, but also technical experts, scientific experts to check on all the technical information that we had, and all the RCC experts and the social communications experts that we have from the Communicable Disease Department. So really, there's one key issue that we need to work all together to find financial sustainability of, not only that hosting that digital space, but how do we adapt it over time, because this cannot be, left here, because we know that it's gonna be needing more adaptation, especially now with the rise of artificial intelligence, greater importance of infodemic management and the impact that we're seeing over digital communications. We need that adaptations are needed. So how can we achieve that? It's one of the things that we need to work on. So I hope that you can all go and find more about this course and do this course in one of the two languages. We're looking into having it in French as well, maybe in 2026 if we get the funding. So you're all very invited to look at the course. Thank you very much.
Thank you so much, Tanya, for allowing us to go through the course, a very interesting one, and with a lot of very practical tools that you also showed us. I think another poll question has been launched that you can see, so feel free to answer that. We have actually completed all the speakers, and now it's an interesting time. We have received a lot of questions from the audience. I turn over to Nancy, and I think the questions will be directed to speakers. And we also have another panelist who will join us in the Q&A, our colleague Vicky from WHO Geneva. But I turn over to you, Nancy, for the Q&A. Thank you so much.
Thanks for that, Lester. We also have Leo Palumbo from the WHO Euro office who will also be part of the panel. So I'm looking at the first question from Praveen. So Praveen is asking what lessons we have taken from previous pandemics related to ethical standards maintained in context of pandemic outbreak and a huge gap in trained workforce and misinformation spread worldwide. She's asking specifically about what to do in terms of what kind of misinformation comes out in the midst of a pandemic. And so I'm going to turn to Vicky. Vicky, can you provide an answer to that question?
Thank you for that question. So I'd like also to please check the answers because we've been trying to answer to a lot of the question also throughout the intervention, as well as putting links. Well, about misinformation, as you know, it really depends on, I mean, this is a very general question, so it depends so much on the context, on the situation, on the pandemic that you're talking about. So not sure exactly what kind of answer you're looking here. For misinformation, I've put also in the chat great training that are taking places. The main rule really is to monitor, I would say, misinformation, rumors, and then depending on the situation is to respond to it differently, to adapt the response to the context, to the situation, to the audience. And I would like to propose to review the Open WHO and the training that also been done by Euro. You've done this amazing training also on misinformation. So hoping this is helpful to this general question. Thank you.
Nancy, you're on mute.
Oh, that happens to me every day. Okay. So Joel is asking about the CapMap tool and if it can be used to assess skills in RCCIM or if it covers capacity in developing RCCIM plans. That's interesting. Yes, it actually assesses, well, it's in a self-assessment. So we're asking people to self-assess what they think their knowledge, skills, and behaviors are around the specific domains of RCCIM. To develop the RCCIM plan, that's actually embedded in there. So if you have the knowledge to be able to do that, so if you read something and you say, I have no idea what social listening means, you rate yourself quite low in terms of your current capacity. And then of course, what your target is, you see the gap there. And then Plan Creator, does it cover development of RCCIM plans? That's exactly what it does. So thank you for that, Joel. Okay, I'm turning to the next question. Manon, I'm going to ask if you can answer Autumn's question. Given gaps and challenges of limited resources, how are you anticipating implementation of RCCIM? And what are pathways to address resource gaps? Manon?
Yes, the only solution for us is co-creation or rather co-construction. Around 30 organizations are participating in the development of this plan. And so each bring its own resources, human capacity, and communication channels. By pooling our resources and collaborating, we will be able, we hope, to build a plan that actually works. I hope I answered to the question.
That was an excellent response. Thank you for that, Manon. Okay, I have another question about the toolkit. So Manon says, can this toolkit be used by WHO country offices outside the European region? Yes. I'll put up a link in a little bit so you can see how you can access it to put it onto your site. So we will share that with you. Thank you. I turn a question to Leo. Yeah, sorry, one second. Let me pull it up. I see more questions are being added, so I'm just trying to sift through them. Sorry for that. She may have taken the question away. There was a question there and it seems to be gone. Okay. Leo, can you talk to Nasiro's question about how we can assess NCC capacity or in future pandemics for other countries? So Nasiro asked about Nigeria in specific, but can you talk in general around how we can use RCCE to prepare us for future pandemics? Leo, are you with us? No, I don't think he is. Okay. And then I had a question for Thomas. And I apologize. The questions seem to be disappearing. I apologize for that.
Yeah, I think it was around how do we improve compliance in rural Nigerian health systems using RCCE? Is that the question? I think I saw it earlier.
I think so, yeah. So in rural areas.
Yeah, thank you. I'm not sure who the question came from, but it's a great question and I'm happy to answer it. I've actually spent many months in northern Nigeria, actually on behalf of WHO, working with the Global Polio Eradication Initiative. So I've traveled extensively to Sokoto and Kebbi and Kano and Jigawa and Borno, and I've got very happy memories of working in very remote villages of Nigeria. And Nigeria is actually incredibly blessed with regards to the community systems and the community infrastructure, actually, with village and ward development committees. There's very strong traditional leadership and religious leadership and women's groups that can be enabled and can be listened to. I think it's critically important that we listen to our communities. As well as understanding their needs, it's also really important to understand their capacities and the knowledge, the innate knowledge that they bring to health and health emergency delivery systems. So that's the starting point where I would begin. And then, of course, incorporating that traditional knowledge and practices, building trust through local health workers, empowering and building the capacity of your local health workforce is critically important to ensure that the quality of service and the empathy of service to communities is really understood and empowered by the broader health system. So just a couple of ideas there, but the question brought back some very happy memories for me, having worked in northern Nigeria for many years. Thank you.
Excellent. Thanks, Thomas. Vicky, I have another question for you from Asma on whether RCCE can be adapted to a crisis in a healthcare sector outside of pandemics. So we've talked a lot about COVID-19, of course, and crisis management and communication plans, but can we apply it to other areas of health? Vicky.
Yeah, to other areas of health, yes, for sure, as well as to different times. So as we mentioned also in some of the answers, RCC is helpful through the full cycle of emergency, so in preparedness as well as in recovery, but also outside emergencies, in order to work very closely with the communities, to co-create with them and to develop tools, but also solutions to their needs and and to the problem that they are facing, to make sure that they have the information necessary for them to be informed and be able to support their families.
Thank you, Vicky. I want to note Victoria's comment about a person with special needs struggling to access the question and following the different links. So I apologize for that, and your feedback is well noted. Thank you, Victoria. Okay, I see Eva Maria has asked about specific training for academic institutions to strengthen their role in RCCE. I can speak for Europe and that we have a collaborating center in Norway, and we work with them, and we're developing different academic 16-week curricula for different institutions. So if you reach out to us, we can share some information about that. Okay. I think these are all the questions that I've seen in the Q&A. I want to also put into the chat box something called a Padlet, and I'm going to share my screen so you can see what it is that I'm looking at. Okay. Okay. So this is a Padlet, and a Padlet essentially just is a communication board. So what we've done here is we've provided the links for all the different pieces that we spoke about today. So Tom talked about RCCE competencies, and so he has the competencies here that you can access quite easily. The tools that I presented, you'll see those here as well. So there's the capabilities for RCCIM. This is the link to the assessment tool, as well as to the plan creator tool, the template. And then if you wanted to translate the content, you can just click here and you can fill in a request form, and we'll get back to you. Tanya shared about the PAHO toolkit. So we uploaded some content for her toolkit, as well as the virtual course. And then we have a survey link that is specific to the RCCIM tools. And then we'll ask you for another survey, of course, because we like to get data that will be there. And the link, of course, is in the chat box, and you can access that probably for another 3 days, and then we'll close the board. You can also add a comment. So if you say, okay, this is great, Nancy, I need help, you can also reach out to us there. So it's just a way to communicate with people afterwards. So again, we won't keep this open for very long, but just know that this is available to you with that chat box link. Okay. I turn over to you, Lester.
Thank you so much, Nancy. And thanks also for sharing that Padlet tool. I think it will be very useful because so many tools, trainings, courses have been shared. And I'm sure many colleagues from different countries will be very interested to ask more questions and engage with the team on how to use them, and also share many of their experiences and ideas. So thanks a lot to the team, and thank you so much for the discussions. Finally, we are at the end of our allotted time. I will wrap up by saying thank you very much to all our speakers and panelists today, our WHO colleagues, and also ECHO colleagues who have worked on this, and the EPI-WIN team. We also saw a lot of inquiries on certificates. We were hoping that your purpose for joining EPI-WIN is really to gain knowledge, updates, global guidance, standards, relevant tools. So we have really designed this to share knowledge on critical areas that we want more people to understand. So I think this year we do not issue certificates anymore. But a big thanks to the work to our speakers again, and our colleagues from WHO Community Protection and Resilience, particularly RCCE in Geneva and Europe. Tom, we have Christiana, Nancy, Manon, Tanya, and Vicky as well, who joined as panelists, from PAHO from Belgium, and our interpreters. Thank you so much for coming and for your active participation through the polls, and through the Q&A, and through the Padlet. The recording of this webinar will be available on the EPI-WIN website, and we will share this. We will also have a digest later, along with the slides. If okay with the speakers, we can share these. So if you want to keep updated on future webinars, recordings, and presentations, please subscribe to our mailing list, it is shared also in on the chat box. We have upcoming webinars this month. So next week, Wednesday, October 22, we have launch of a framework for civil society organization engagement, CSO engagement for health emergencies. And then on the 29th, we will have strengthening One Health multisectoral collaboration through the National Bridging Workshop NBW program. So keep updated on these upcoming webinars. Thank you so much, participants, and thanks also to our speakers. Thank you all and goodbye. See you next time.
Thank you so much.